Unless she had a
Maybe.
former name or something, but
Yeah.
like this is her official stuff.
Please mute your computer.
It's recording, Dr. Morris.
I think we got people muted now and we're recording, so we'll go ahead and get started. I know last week we had some trouble with seeing the screens. Are you all able to see my screen right now?
Yes.
Yes.
Okay. All right. Well, holler if you can't. I cannot see the chat box right now, so just unmute yourself and say something if you cannot see the screen, and I will try something different. All right, so we'll get started. Again, this will be posted on our website later. I know we've had some delays getting our recordings up on the website. Teams has been weird and we've all been busy, so we are still posting everything. So if you're not with the school system or the health department, we ask you to drop off the call to allow time for question and answer with our staff and the school staff, and make sure that all the information gets passed on to those that need it within the system. Just a reminder, last week we did discuss the change in quarantine recommendations. That has now been placed on the CDC website in a bit more user-friendly fashion. When we talked last week, it was only in the clinical consideration.
COVID-19, excluding people who have had COVID-19 within the past 3 months.
I'm not sure who that was, but I'll continue. So before it was posted only in the clinical considerations, which is where clinicians go for answers. Now it's on the public facing. So one of the bullet items here is that those who have been fully vaccinated within the past 3 months do not need to be quarantined. It's not a specific thing that you have to be 2 weeks out, but that is the recommendation. So that again is more publicized, and the state and we at the local health department are following those guidelines. So that is the law of the land at this point. It is not different if you've been exposed to someone with the B117 variant. There's no guidance right now for the other variants. So if, heaven forbid, we get different variants in this area, we will notify people if something different needs to happen. But right now, that is the recommendation for the current variant we have in the majority of Michigan, and also for the B117 variant. Just a research update. The bottom bullet here, they did add quite a bit of new literature review to the School and Community Resource Library, which is at this website here. It's over 200 pages now. They highlight whatever is new there. So if you want to look at new data and resources, that's there. To go over all of it on a call would just take up the whole time and probably bore you to death. But one thing of note, they did have an article about the variant B117, and it does not appear to cause any more serious illness, hospitalization, or anything in children. In adults, it doesn't seem to cause much different illness. There's still some debate about whether there's an increased death rate that is due to some review of evidence in the United Kingdom, but again, that's still debatable. So I just wanted to share that as it pertains to our children. Travel, we talked about the uniform recommendations for travel now. It's not specifying a difference between domestic or international, just recommending quarantine and testing after travel. I just communicated again today with the state to see what kind of guidance they're going to be coming out with, because I've been promised they'll be coming out with recommendations. But I'm not holding my breath on that. It's doubtful, and I didn't expect them to, but it's doubtful they're going to require quarantine, and I never expected them to. So, we likely will never require any kind of quarantine. I just wanted some guidance on things like what is considered travel, what should you as an employer recommend to your employees and to your students, those kinds of things. So I'm still trying to get some guidance from the state, simply because I would like to have uniformity from county to county, school district to school district, health department to health department. So there isn't a difference. I'm still trying to get that. And if I'm not going to get that, we will just give some guidance on our own. But again, I know how difficult it is when there's differences, like I said, from district to district and county to county. So again, it'll likely never ever be a requirement. It'll just be recommendations. But again, just to know, what is travel? Is it a trip up north for a night, or does it have to be a week away in another state, that kind of thing? So I am actively working on trying to get some guidance on this. It has just been challenging because there's just so much going on, and only so many people to do it. I have some thoughts of what I would suggest, but I'm really leery to say them out loud because I don't want people to run with it and then have to retract them tomorrow when I get guidance from MDHHS. So
thank you so much, Dr. Morse, for your thoughts about something that would be the same for all, because we do get so much difference between where people live and work, and that health department says one thing, and I appreciate very much your consideration for something that's consistent for all of us.
I know, and it's not just, it's for you, we have other employers that ask, and also, our own health departments, we are an employer, and so we have employees that we have to manage as well, and so it's just so much easier if we can have a uniform, consistent message that's statewide, because it just gets so difficult, especially if you have a husband and wife travel, and the wife is your employee and the husband is somebody else's employee, and they have totally different guidelines. It's just, we know how awful that is. It's just, again, trying to get that message and get that done has been pulling teeth this whole time. And I understand, because there's much more critical things to get taken care of, like, outbreaks of variants and vaccinations and things, but still, we need that answer. So I am working on it, and I know spring break is right around the corner. But if I have a meeting with some key stakeholders at the state next Tuesday morning, and if I'm still getting pushed off, I'm just gonna do something. I'll just write up something for you guys to have as guidance, because we just can't wait any longer. So that's that. My 2 cents on travel. So here is our data, and this is still going in the right direction. Extremely happy. Our daily cases per million in the state are at double digits per million. So down to 76 from 129, and the percent positivity is down to 3.7 from 4.2. I'm just gonna kind of scroll through it. Just the variety of colors now is just really nice to see. We used to be this dark purple color all throughout, so we're getting down to even having some B level, the medium high B level, which is almost as low as you can get. Low is the lowest you can get, but we're getting there. The average for Central Michigan District is 89. Last week it was 128. So again, a big drop, and then 3.7% positivity from 5.6. The 10 counties in District 10 is down to 98 from 123, and percent positivity is down a little bit at 4.6%. And the counties in Michigan District Health Department's down to 97, right around 98 from 127, and percent positivity is pretty stable at 2.6%. And so again, and most of these are all minuses. So continuing to go in the right direction. Hopefully the trend will continue. We will send these numbers out to you. Those are all from the My Start map. There we go. So those are available to you as well. The following slides, unless I say differently, are all from the COVID data and modeling update, which is available on the state website. These come out weekly and they provide some really great visualizations and data. So basically, the state as a whole has continued to decline in rates and positivity for 5 weeks straight. We're down 85% since mid-November. Only 5% of inpatient beds are filled with COVID patients, and the hospitalizations are down 79%. COVID hospitalizations are down 79% since the beginning of December. We have given over 1.5 million doses of COVID vaccine, and so that's about 14% of the population. And this was as of almost a week ago. So these are just the positivity trends, the daily cases per million trend, and the daily hospitalization rate trends for the state in graph form. And then this is just a visualization of our hospitalization trend. And again, we're getting closer and closer to our lowest levels that we had over the summer. In terms of the variants, there are all 3 variants in the United States. We currently only have B.1.1.7, which is the European or the United Kingdom variant in Michigan. We are the 3rd leading state. We might be the 2nd now. One of the reasons is that we really are aggressively watching for it and testing for it, because we do have 2 labs that are testing for it. The reason I say 2nd is, again, data changes daily. So we had 157 cases in 12 counties and the state of, the city of Detroit. But we added 90 positive cases, 88 of which were from prisoners in Bellamy Creek Correctional Facility yesterday. And there are more than 100 other labs that are still pending. So, we might be adding quite a few more. So up to 247. Very likely, again, over the next few months, this will become this will take over as the variant that is the main variant. So it will just be the normal variant. But again, it is about 50% more contagious. So, if it normally would spread to 1 to 2 people, this would spread to 1.5 to 2 people. It would go to just a little bit more people. So we just need to be extra vigilant about our preventative measures and really be aggressive about vaccination. It does appear that the vaccines we're using currently are as effective or nearly as effective. If there is some decrease in efficacy, it's not huge. So the faster we can get vaccinated, the better. And we all know that we're working as hard as possible at that. There was a slight decrease in outbreaks over the last week, including a small decrease in school outbreaks. These are the school outbreaks. So you might remember last week there had been a huge jump in high school outbreaks. It has actually gone down a little bit, but more and more schools are going back to in-person learning. So we expect there to be more outbreaks because there's more schools face-to-face. This is data that I pulled from the website for the 19 counties that I cover. For preschool to elementary, there are no new outbreaks. So there were no outbreaks that started in the last week. There are 2 that are ongoing within a county in District 10's territory and one that's in Mid-Michigan district. In those 2, outbreaks, it's only 5 cases total. And that just means that it has not been a full 28 days since the last case started. Junior high, middle school, there's been no new outbreaks. There's one ongoing, that's 2 cases. In high school, there's no ongoing outbreak. There's 1 new outbreak.
Get eyes on him. I got to take 4th grade out.
Can you guys make sure your phones or computers are on mute? I'd appreciate that. Thank you. And for administration, we still have 4 ongoing outbreaks, and there are no new outbreaks. So really, I mean, very minimal for the number of students we have in the 19 counties. Really very minimal number of outbreaks. The turnaround time for testing in the state is actually shorter than it was last week. So, you know, testing turnaround is very quick when you need to have people tested. Case investigation, we are, as a state, getting through complete case investigations for at least 65% of all of our cases. 45% of people that are investigated or contacted say that they know where they caught their COVID from. And 25% of people are in quarantine when they're contacted. We are just going live with a new program. It's called PEG, which is Patient Education Genius, where people who are identified as a case will actually be texted and given their interview as a kind of like a Survey Monkey type application on their phone, because we all know most people are not really good about answering phone calls, but they tend to answer text messages pretty well. And that has been found to get more people to respond to these case investigations. So that has gone live or will be going live within this week or 2 statewide. So we're real hopeful that that will improve our case investigations. This I showed last week. This is just updated numbers, just showing for our people 75 and over, our vaccination of first doses has gone up from 28 to 35%. And at least a third of those people have had 2 doses. And in all these, in these age groups, at least half or a third have had both doses. So just to look at the ages, you know, it's great to see that over a third of our 75 plus have been vaccinated with at least 1 dose, and that's, you know, again, increasing from last week. So just some nice numbers to share. And this shows the vaccinations from day to day, starting at day 1. The dark bar is first dose, the more teal bar is second dose. So just plugging right along with vaccinations. Just a little update on the fall sports testing pilot that was done with swimming, football, and volleyball playoffs as a pilot, mainly just to see was it possible to do testing in sports. And so they did find it was possible to do testing in sports at schools. It did pick up 69 confirmed cases. So they were ones that were positive on the antigen test and then went on to have a positive PCR test. They were all asymptomatic. That ended up being about 1% of the tests that were done picked up a confirmed asymptomatic case that would not have been otherwise detected and could have gone on to spread illness throughout the team and could have caused outbreaks. So right now there's 2 testing initiatives. One is the voluntary testing of teachers once a week with the rapid antigen testing, and then the other is the sports testing that's 3 times a week for those that cannot safely wear masks, and then once a week for other sports, which is voluntary. So these are the numbers that are involved with that. So just sharing that information. So that is all that I have for an update this week. I will stop sharing and I will go to the questions in the chat. And if you have any questions, you can put them in the chat, and
Supposed to be, yeah.
then I'll open up to questions on the phone. All right.
I want to say it's Shelly. So
Can people make sure their phones and computers are muted, please? Thank you. Okay, received notice from a basketball team that they will have a player not wearing a mask in tonight's basketball contest, claiming that MHSAA approved this. So there are no exemptions to masking at all. So you either wear a mask or you don't play. So I don't know what the High School Athletic Association is saying, but it is very clear in the epidemic order and the FAQs and things that there are no, the only reason you do not wear a mask is if it is unsafe to do so, such as during a wrestling competition or wrestling practice, tumbling on equipment with gymnastics, that kind of thing. So, I think you just have to talk with that team and tell them that they're not allowed to play. I don't understand. If they have something in writing from MHSAA, I would be happy to see it, and I will forward it on to the state, because that should not be approved. But I would demand something in writing on MHSAA letterhead, and then I would still not approve it, but I would like to have it so that I can show it to MDHHS so that they're aware of what's going on. Following complete vaccination in 2-week period of time, can we contract COVID with or without symptoms and spread it? So the 2 vaccines that we have currently out there, the studies were done to see if they prevented symptomatic infection. Studies are ongoing to see if it prevents asymptomatic infection or asymptomatic spread, things like that. Since symptomatic infection is more contagious, one would assume it's going to prevent asymptomatic infection and asymptomatic spread. But again, you can't assume. So studies are ongoing. But because we don't know that for 100% sure, that is why we continue to wear masks after we're vaccinated. Mask use by someone who is infected will prevent transmission if it's a 2 or 3 layer mask that has a good fit by 70 to 90%. So again, given that it is pretty darn likely that the 2 vaccines are going to prevent asymptomatic infection as well as symptomatic infection, which is 95%. And then if for some odd reason there's something different about an asymptomatic infection, which it really should not be, your mask is going to prevent it in addition to what the vaccine prevents it. We're pretty confident that things will be prevented. But that's why we have you continue wearing masks. And again, they are researching that further to confirm that so that we're not just assuming that. But with other infectious diseases, vaccination typically does prevent, when they can study it. It's really hard to study that, the prevention of asymptomatic and asymptomatic spread. But in most other illnesses, when they've been able to study it, vaccination does reduce those risks as well. So hopefully that explains it. I know that's a difficult one. We are currently in a hybrid model and hoping to return full-time in a few weeks. Weekend, I heard a lot of experts say the new variants might make the next 14 weeks some of the worst yet. Are you hearing or seeing anything that would lead you to recommend hybrid? So our modeling suggests that if you have not had good control over viral spread, thinking of states like Texas or Florida or things like that, and you're not following good mitigation measures, you're not wearing masks, you're not doing things like that, as the new variant takes over, since it is more contagious, it could look like October, November again. If you have things under good management, as we do right now, and you're actively vaccinating, we might see a little bump around March or April, but it really should not be that bad. All along, I've kind of followed the let's see what happens rather than let's not go to school because it could happen. And that has worked fine. I think the schools we've worked with have felt, and they can correct me if I'm wrong, but have felt that that has worked well. You know, if you see more cases, if you have outbreaks, you can always go back to hybrid, or you can, you know, if you need to close for a short period of time, you can. But to not have in-person school because something might happen has a lot of negative consequences to your students and their families. So, can band and choir concerts be held within the parameters of the orders? So you would want to look into the orders and look at the gathering requirements for the facility you would have the concert in. So, you know, usually it's 20% and maximum capacity of 100, depending on the facility you're having your concert in. So again, just look in the epidemic order and look at the gathering restrictions and follow those. Typically the number, because you have to include your students in that number. So typically the number is low enough that it would be real challenging to do that. You may be able to have your students and, you know, maybe a guest, but if you have a larger band, you might just be able to have your students and then live stream it. But again, refer to those restrictions and then see what you can do. If we know a student is supposed to be quarantined and they are not following the rules, is there any recourse, such as still participating in school sports? Well, if they're your student, obviously you can forbid them from being at school or going to school sports. If you're having issues with them doing things outside of school, you can call us and then we can work on educating them and their family. But for the things that you have authority over, you know, you can forbid them from being there. If you have questions as to whether or not they are still in quarantine or not, and you need that clarified as to when quarantine would end, you can call us and we can make sure, you know, what date they might be able to return, because there might be some discrepancy between when the school might think they can return and when they really can return, things like that. So yeah, you don't have to allow them to be in school or sports. Are there limitations to the size of meetings that can be held in school buildings after the school day? The meeting would include parents and students with staff members. So just to clarify, just because you can do something doesn't always mean you should do something. So even like with the band concert and sports, you know, we want to do things as safely as possible. If you're packing people into the, you know, the maximum you can, and it's pretty tight fit, you have to think, you know, is this still safe? If you could have a meeting remotely, is that safer? So just keep that in mind. We still want to do things as safely as possible, but again, sometimes it's hard to have meetings or different things remotely. I can't pull from the top of my head what the epidemic order says right now. I would have to go back and look at it, but all those rules are in the most recent epidemic order. I just honestly can't recall. So I would just have to refer you to that. And if you have questions, I can always try to help you after the call. Any other questions, if you want to type them in or just simply unmute your phone or computer and ask them?
Dr. Morse, we were advised by our attorney that if it involved public people coming into the school, then we had to follow the gathering restrictions that say potentially no more than 10 and can't be from more than 2 different families. So I don't know if that applies or not. As long as it was only school staff, then you're exempt from that. But as soon as it becomes a public meeting, like a board meeting also, that we were bound by those other restrictions.
Okay. Yeah, and I'm not as great with some of those rules as maybe some others are, and so that's why I'll just refer you back to those, and if there's questions, we can try to help you with them. But if it's a school meeting, if it's something for school, like teachers meeting with parents and students, again, if you have legal counsel that can help work you through that, that may be all the better. Anything else? Well, hopefully things stay this level and we don't have a lot of controversy and issues, and the second half of the year is a little different than the first. Any ideas on when the Johnson & Johnson vaccine will be available? So the FDA will hear its testimony for the emergency use authorization a week from tomorrow. And then the CDC will hear, the ACIP will meet on it, I believe, the following day, so a week from Saturday. And then once that's done, they should be distributing it really shortly after that. So it should become available very early March, like the first or second week of March. Is choir class allowed to sing? Can band play? Yes and yes. If you go to the frequently asked questions for the epidemic order, so to do that, you go to michigan.gov/coronavirus. You go to, I'll walk you through this. Then go to resources, then go to the state orders and directives, then the MDHHS epidemic orders. The second thing is the February 4th gathering and face mask orders. And the third bullet from under that is the FAQs. And if you scroll down within the school and university section, there's one that says, are non-athletic extracurricular activities permitted under the order? And it says they are permitted except where a mask cannot be worn. Activities involving singing and the use of musical instruments are permitted so long as masks can be worn at all times. Slip masks are permitted only when students are playing wind or brass instruments. And then it says, see the MDHHS's guidance for band, choir, and orchestra programs for more information. And that is a live link that goes to a pretty detailed document that gives you guidance on how to safely have those programs. So I'm sorry if you already talked about this. Yep. Do we have CMDHC's recommended not needing those exposed? Yes. So you have our guidance, you have MDHHS's clearance and the CDC's clearance that if you have someone exposed to COVID who is more than 2 weeks past the full series of their vaccine and within 3 months of their first dose, that they do not have to quarantine. So if they had their first dose today, but they didn't get their second dose for 2 months, and then they were exposed a month later, they would still have to quarantine. You just have to keep that in mind. If there's any questions about that at all, if it does come up, let us know and we'll help you through it. Make sure to explain to staff and others who've been vaccinated, they still need to wear a mask, still need to distance, still need to wash hands and things. And if they have any symptoms after exposure, obviously they need to get home and follow up with their healthcare provider. And that information is now on the public portion of the website for the CDC. It's not buried in some technical page anymore. And that is in my slides, so you will get that. Any other questions, guys? And if you think of them later, you can always call. After the second dose, no quarantine for exposure. That expires at, yep, so 3 months after your first dose was given. And that starts 2 weeks after you're fully vaccinated. So for the vaccines we have right now, that's 2 weeks after your second dose. Once Johnson & Johnson comes out, that's a 1-dose series, so it'd be 2 weeks after that dose. So that's how you'll see it written, is 2 weeks after you're fully vaccinated, because now that we get more vaccines in the mix, it's going to get more and more confusing. So, all right.
Dr. Morris, I have
Go
one
on.
other question
Yep.
if you have time.
Okay. Yeah, go ahead.
This summer, it was recommended that we have elementary specials held in the classroom rather than going into the individual classrooms for art, music, PE, and so on. And I think that was mostly around the idea of spreading on surfaces and so on. But I'm wondering if there's been any change in those recommendations, if anything's evolved to the point where it's okay to have gym class in the gymnasium, music class in the music room, and art in the art room.
So the idea with that was to help maintain your pods and to prevent exposure more than necessary. So if you have kids going through the halls, passing people, and you have someone who's contagious, is that going to make it really difficult to track down the spread of disease? It is still recommended to do everything possible to keep kids with their same pod all the time and to minimize movement and that kind of thing. If you feel like, and also not sharing items, and so, if they go to an art room, are they going to be sharing items? Are they going to be touching more things? Are they going to be passing by other classrooms? Are they going to be passing by other students? So none of that has changed. If you feel as though them going through the school to a different classroom is not going to lead to spread that way, I guess that's your own decision. To me, to have a teacher move causes less potential spread than having a whole classroom move. But I guess, that's, your environment and what would be safest. So that's the logic behind it, is just, look at each kid and even each teacher as a little petri dish, and what's the least likely way that petri dish is going to smear germs all over the building.
Sure. Okay. Thank you.
Yep. Any other questions? All right, well, we'll wrap it up. We will get materials out and on the website. And if you think of anything else, call or email and we'll help you out. Have a good rest of your week and weekend.
Where's the recording part? Yeah, I can't see. Can't see.